Hi guys, how are you? First of all, Merry Christmas and Happy New Year to everyone. So it has been one day over 3 weeks post-op. I'm doing fine, as you can see, no problem. Gel lütfen. I have started walking slowly, and
Bisiklet bahsediyorsun.
what?
Bisiklet neyse abi.
Yeah, I'm doing cycling a little bit in the house, stationary bike, because I have ankle fusion, so I can't do regular bike. Well, I'm feeling fine, no nausea. My blood pressure is getting lower and lower by the day. First I was taking 2 medications for it. Now I'm taking only 1. That's 1 as in 1. So I'm feeling better, Well, when I started this journey, I was 153 kilos, so that's over 300 pounds. 2 days ago, I was about 135, so I lost 15 kilos, so about 30 pounds in 3 weeks. But this is the first time that you lose weight so fast. It will not go like this afterwards. I'm trying to be careful with my protein shakes, taking them every day. I still haven't started eating, solid foods. I'm drinking mostly liquid stuff. Trying to be healthy and exercise. So, just wanted to say hi to you guys and just keep you posted. The date is today, January 2nd, so we just celebrated the New Year's with our family, and it was a good thing. It gives me hope for the new year, for 2015. So all in all, I'm going to see my doctor within a week for my 1-month post-op visit. My sister tells me he doesn't really do much, then he just weighs you and he says you're doing good. So I'm like, why am I even going, The 3rd month visit, he will take some blood samples to see your vitamins and minerals in your blood. I'm taking my multivitamin, B12 vitamin and calcium. So I guess I just have to keep the stressful thoughts out of my mind, focus on getting better, getting fitter. Because what I want is, in this year, while I have a low appetite, in 2015, my dream is to start doing more walking and then start swimming, and then in a few months start weightlifting slowly with very, very little weight, but just to keep toned, because I want to feel fit, not only slim but fit. Right now I can barely walk 10 minutes and I'm tired. Not even 10 minutes, maybe 5 minutes. What else? So I'm thinking in my mind how to switch to solid foods. I guess I'm gonna start with stuff like, boiling carrots, making, pureed foods. And then we'll see how my stomach tolerates. I had scrambled eggs and because I had them in the evening, about 9 p.m., I couldn't go to bed because the scrambled egg was literally sitting right here between my new tummy and my mouth, you know, in here. So I read about that. Apparently, when some food is too much for the stomach, it just pushes it towards your mouth and it starts digesting it there. So all the acid goes in your throat, and I had sore throat the next day because of the what they call reflux, which is the stomach acid which comes back to your mouth. So I have to be careful with that, even though I'm taking anti-acid medicine every day. Empty stomach when I wake up. I also take twice a day medication against gallbladder stones. Apparently, after this surgery, we are at 40% risk of developing gallbladder stones, which will eventually require another surgery. So that's why I had asked my doctor, I said, you know, once you cut me up, can you also take my gallbladder? And he said, well, you know, you're gonna take medication 6 months to a year, and we'll see if you will develop gallbladder stones. But I don't want to take it before you develop the stones. However, some doctors, some surgeons do that in, we can turn from here. They do it in the States, so if I have the operation, I will have to go through all the shit again, you know, and you know, pay again for the operation, so that sucks. Otherwise, I think I'm already outside the risk of how do you call it, blood clots. I gave myself injections for 20 days. So for 3 weeks post-op, I gave myself Clexane injections, which dilutes the blood so that there is no blood clot in the legs which goes up to your lungs. That was a big scary thing for me, so hopefully I'm not gonna have that, so that's a good thing. So other than that, I just have to be more active, you know, start doing stuff, whatever you can do. Not only to burn calories, but to feel fit in life, you know. Otherwise, what's the point, right? If you're not active, if you're not strong and fit. So that is a mental game. I just have to tell myself every day to go outside for a walk, which is not easy, you know. Most days I tell myself that I'm tired. I think right now I'm taking about 600 calories a day. I take 3 scoops of the protein shake, so that's about 300 calories, but it gives me 75 grams of protein, so I have to take that. Then I have some soups, altogether another 300 calories. I think all in a day I take between 600 calories to 800 calories. With that I am losing weight with 800 calories. But I guess before the surgery I was taking, I don't know, maybe 5,000 calories. So I do feel a little tired, but it will pass, you know. So thank you for listening. I hope if you're contemplating on having gastric sleeve surgery, I hope this helps you. I recommend it as a patient who had it 3 weeks ago. because it will be a new life for you. But you have to know that it's only a tool. What do I mean by that? I don't feel hungry, but I feel mentally hungry. When I see my nephew eating good stuff, I want to eat it too, not because I'm physically hungry, but because I'm used to the emotions associated with the comfort food, you know. I mean, the happiness, the endorphins and the dopamine that my brain releases when I bite into a good burger, that's the feeling that I miss. So it's the emotional addiction to food, which will be a real challenge, especially in a year from now. So hopefully I'll keep you posted. Thank you for listening and see you on my next video blog. Bye now.